you.
I'll be here. This patient has only been with us 2 or 3 days,
Yes.
and a returning patient.
Yes.
And he's returning because of a radon problem he was in
Yes.
from moving office to office,
Yes.
and perhaps drinking Clorox water again,
Yes.
and went downhill again.
Accidentally getting it. We'll learn the details of that soon.
And we're learning that daily with the saliva samples we're getting as we continue to test for the toxins that have built up in his system that caused the problem to begin
Yes.
with. Okay.
Yes. He had leukemia,
Mm-hmm.
and that was maybe 4 years ago or so.
Mm-hmm. As I recall, he came to us with prostate cancer,
Yes, that's right.
leukemia.
Yes.
What else? He had about 4 diseases.
He had been
Malaria,
referred
cancer.
to organizations for terminally ill,
Mm-hmm.
and he certainly never had any hope of getting back into working life.
That would be hospice that you're talking about.
Yes.
So, and as I recall, the last 4 or 5 years, he's been working day and night.
Yes,
He's
he's
a
very
real
hard
Trojan.
working. He loves to work.
He does, yeah.
And he's also without pain. When he came, he was in extreme pain because of the bone cancer that had already developed
When he came some years ago.
some years ago.
And he was on a walker
Yes.
when he came.
Yes.
And then he didn't need the walker for a while. He was gone.
He hasn't needed a walker all these years.
But
Yes.
the last few months, he's deteriorated,
Yes.
gotten back on a walker, and,
Yes.
and is
Gotten
in pretty
back
bad
into
shape
the
now.
old causes that cause such things accidentally because society hasn't improved its status. Society has become more toxic, not less toxic, and it's very hard for an individual to know what to suspect.
Mm-hmm.
It's hard to know that when you're eating bread, you're eating gold. That when you're eating water, when you're drinking water, you're likely to get cyanide. You always get cyanide from chlorinated water, and that the chlorine itself is a big depressive agent. We don't know those things. That the chlorine is such a reactive chemical that when it's in you, it will combine with your neurotransmitters. Of course you'll get depressed if you're a little bit on the low side anyway.
Mm-hmm.
And certain ones are more susceptible to chlorination.
Mm-hmm.
The disease called manic depressive, for instance, is always due to chlorine gas, which escapes from the water, especially as you're taking a shower. I think somebody estimated that a shower is worth about 6 tall glasses of water that you may have drunk instead. That's a lot of chlorine
Chlorinated
going
water.
into your body. Right. But chlorine isn't as bad a culprit as those things that come with the bleach that brings the chlorine.
The potassium, ferro, and ferricyanide.
Yes, the cyanides, the traces of automotive oil and wheel bearing grease, traces of alkylating agents, mustard oil, and so on that came with the petroleum that was dug up from the ground.
And along with that is cerium, and cerium combines
polonium.
with
For the cancer.
polonium to complete the complex.
Yes, that causes cancer.
Mm-hmm.
Other diseases are caused by very similar things, having just a slightly different cyanide, and a lot more automotive products.
That would be the potassium ferricyanide.
Yes, so that is the one that leads to other diseases rather than to cancer.
What you call the wheelchair diseases, the ones that put you in a wheelchair.
Wheelchair diseases, yes. We could easily clean up our environment. It would be that's disease causing. It's not such a dreadful story as we might think, and almost put ourselves into a panic over when we read the magazines on the environment. There are really only a few very bad causes, and they are causes that we all get, like drinking the water. and then cooking with the water, and the way we store our food is just a few things that are really causing all of our cancers and diseases. Maybe less than half a dozen problem items. So we could easily clean that up. We don't have to suffer from all these diseases, including the genetic diseases.
Mm-hmm.
So the picture is not nearly as gloomy as we might have thought. We don't have to be depressed over it. We only have to be activated so that we get to work, verify the things I've found, because nobody's going to accept synchrometer results and the way that we do our research and do our treating. If agencies had been interested in finding cures for different diseases, they would be here in Mexico having watched people do it for decades already. But nobody comes here to watch how we do it, so nobody's really interested. Parents try to come often, and of course a suffering patient tries to come, but there is no general explanation of what is done at a particular clinic, and it is often rather sophisticated so that the patient can't understand. But a doctor could easily understand if the doctor were interested.
Mm-hmm.
I would like to invite them with a video like this to come and try to understand what different clinics are doing to cure or treat and do much better than our present clinical treatments.
Mm-hmm.
So here in this video, I would like to show how easy it is to cure a jaundice case or prevent a jaundice. Whether it can be done when your jaundice level is as high as 20, I'm not sure. It would take, when we get somebody as high as 19 or 20, we jump into action on day 1. We have the blood tests. Obviously the patient's coming in yellow, and we have the blood test done immediately, and we look at the results within 3 hours and start already, since we know the problem, we start immediately on taking heavy metals out of the kidneys so that the kidneys will be able to handle the metals coming out of the liver.
Mm-hmm.
So by jumping into action so that we have already important things done by day 2, we save such a patient.
Mm-hmm. By the way,